Greetings, everyone. It is a lovely morning here in Southeast Georgia. I actually see the car thermometers reading in the 60s today. Oh man, it does feel quite nice this morning. It's pretty cloudless, pretty nice. You really feel that the fall vibes really coming in. It's quite wonderful. Didn't get a video out yesterday. Had some personal errands I had to run pretty much all day, so took care of those. And yeah, it's crazy seeing those very brave women coming together at the Capitol and sharing their stories, though in a limited fashion, about their experience and their victimhood, I guess. I don't know, I'm trying to find the right word. But their experience with Jeffrey Epstein and Ghislaine Maxwell and all the perpetrators that they exposed them to, you know, just horrible people. And they only name dropped one person besides the two people who were already convicted. Very interesting. Marjorie Taylor Greene had something to say. It's funny listening to her blame the state of Israel for the crimes of Jeffrey Epstein, though his connection and Ghislaine's connection with that country and Mossad do seem pretty firm. Feels like she's taking this for the wrong, or she's supporting this for the wrong reasons, not the right reasons. But anyways, let's get into the news.
Washington, I'm Cora Coleman. The Senate Banking Committee holds a hearing today on President Trump's latest nominee for a seat on the Federal Reserve Board. NPR's Scott Horsley reports the hearing comes at a sensitive time for the central bank.
Trump has tapped White House economic advisor Stephen Myron to fill a short-term vacancy on the Fed board. If confirmed, Myron will take the place of Adriana Kugler, who stepped down last month. Trump is also trying to free up another seat on the board by firing Fed Governor Lisa Cook. The president and his allies have accused Cook of making a false statement on a mortgage application. Cook has not been charged, and she's gone to court in an effort to keep her job. If the president is successful in replacing Cook, a majority of Fed governors will be Trump appointees. Trump has repeatedly demanded that the central bank lower interest rates, even though by law the Fed is supposed to be insulated from that kind of political pressure. Scott Horsley, NPR News, Washington.
Health Secretary Robert F. Kennedy Jr. is set to testify before the Senate Finance Committee today. He's likely to be asked about some promises he made during his confirmation hearing this year and is broken. For example, Kennedy promised not to change the makeup of a major federal vaccine advisory panel. Instead, Kennedy fired everyone on it. Louisiana's governor says he'll welcome National Guard troops if they're sent to New Orleans. Member station WWNO, Aubrey Uhas reports the reaction from city officials has been mixed.
Crime in New Orleans spiked during the pandemic, but has since fallen, and the city is on pace to log a historic 50-year low in murders this year. City officials noted that decline. They thank the federal government for its past help, including after January's terrorist attack, but didn't say whether they support the president's current offer. Councilmember Helena Moreno, the frontrunner in the race to be New Orleans' next mayor, said in a statement she will fight to prevent any federal takeover of New Orleans.
Yeah, bringing in troops is not going to help local policing efforts unless your only goal for local policing efforts is to intimidate the populace with, you know, paid killers, paid warriors, you know.
Country's strictest crackdowns on abortion bills. From member station KUT in Austin, Olivia Aldridge reports.
Texas already has a near total ban on abortion. The newly passed bill aims to curb the practice of out-of-state doctors prescribing abortion pills to Texas residents and sending them through the mail. State Senator Brian Hughes champions the bill in the Texas Senate.
If you manufacture, distribute these drugs and ship them to Texas for the purpose of killing a little unborn baby, harming a mom, you will be held accountable.
If the governor signs the bill into law, private citizens would be able to sue out-of-state providers of the pills for $100,000 or more. I'm Olivia Aldridge in Austin.
You're listening to NPR News. A bipartisan group of House lawmakers is introducing a bill that would ban lawmakers from trading individual stocks.
Hell yeah.
Supporters say it's intended to address voters' worries that lawmakers could engage in insider stock trading. Watchdog groups have questioned members of both parties about personal stock trades. Some have asked if the lawmakers were influenced by information they got privately while serving in Congress. The conservative news outlet Newsmax has sued industry giant Fox News. Newsmax claims
just look at literally the months leading up to the COVID pandemic, from December of 2019 to, you know, the height of the first COVID summer in like June, July of 2020. Congress was making, or sorry, not Congress, members of Congress who already had like big stock ventures and a lot of money to put into stocks were making pretty big moves. They were making pretty big moves to dump stock in certain companies and to buy stock in others. You know, it was very obvious what they were doing, but they'll just, you know, deny. Like, no, I'm just making a good investment, and you know, I mean, it's like was it Pelosi, the Pelosi traders, the people who try and mimic her buys, even though they're always a good bit delayed because congressional members don't have to disclose buys immediately. There's a little bit of a waiting period that they can take advantage of. But people who have followed, you know, the Pelosi trading model have made good money, but not as much as her, of course.
Would you like to buy a minute?
I would not like to buy your minivan.
And what happens to all the metal and hazardous fluids? Our reporter parts with the family Vanny, who's 20 years old with 183,000 miles, and it has wasps. The Fan Vanny on the next All Things Considered from NPR News.
All Things Considered from 4 to 6 this afternoon, right here on GPD. This is Morning Edition on GPD. Good morning, I'm Pamela Kirkland. Thanks for starting your morning with GPD. Just ahead, let's go on a field trip. NPR Stephen Keith visits the Smithsonian's National Museum of American History in Washington, D.C. ahead of what the Trump administration says will be a systemic review of divisive or partisan narratives. We'll take you there coming up in 15 minutes right here on Morning Edition on GPD.
Support for GPD comes from you, our listeners.
It's just another ploy of trying to whitewash history to be as appealing and as comfortable to those who are already in power, who have their own biases, who have their own hatreds of people, and you know they want to continue the lies and the fairy tales that we were brought up with in, you know, elementary school. It's all it is. It's people who are too uncomfortable with history and the truth, trying to make history their own.
Ending vaccine requirements, and 3 Western states are forming alliance to protect and even expand access to vaccines. We'll have more from Florida and hear from Washington's governor shortly.
But first, Health Secretary Robert F. Kennedy Jr. testifies in the Senate today after a week of upheaval at the Centers for Disease Control and Prevention. Last week, Kennedy pressured the brand new CDC director Susan Minaris to resign, and when she refused, the White House fired her. Then, 3 top CDC officials resigned in protest.
Thank you, Stephen. Here's tell us what to expect at the hearing today. So, Selena, technically, this hearing is not about the turnover of leadership of the CDC.
Right, this is a Senate Finance Committee hearing announced last week to go over the President's 2026 healthcare agenda.
Okay, so that's the stated topic. But what do you think senators might ask Secretary Kennedy about?
Yeah, I'm expecting it's going to be like a lot of hearings in recent years where there's kind of a split screen depending on the party of the senator doing the questioning. When Democrats are asking the questions, I think they're going to hammer Kennedy about what happened last week at CDC and about vaccine policy. Kennedy has replaced a key vaccine advisory panel with his own hand-picked roster of people who have a history of anti-vaccine activism. They are set to shape up recommendations on a variety of vaccines later this month. Several Democratic lawmakers, a variety of public health groups, and more than 1,000 current and former HHS employees have all called on Kennedy to resign in the last 2 days. And some Democratic states are now making moves to try and run public health without relying on CDC, given all of the chaos there. Yesterday, California, Washington, and Oregon launched the West Coast Health Alliance to coordinate their own health guidance and vaccine recommendations.
Okay, so that's what you expect to hear from Democrats. What about Republicans?
Republicans are moving in the opposite direction. Florida announced plans to end all vaccine mandates for children and adults yesterday.
Gross.
I think Republican senators will talk a lot about Kennedy's Make America Healthy Again agenda. He's been traveling all around the country with governors who are signing state laws related to some of his food-related priorities, like limiting food dyes and ultra-processed foods. There may be Republicans asking about the drastic cuts in biomedical research funding. I think a lot of people are really going to be wondering what Republican Senator Bill Cassidy of Louisiana is going to say at this hearing in particular.
Ooh, Bill Cassidy, why him? Why is that?
Well, Cassidy is a physician. He chairs the health committee which oversees HHS, and he believes strongly in vaccines. Kennedy won
Yeah, 'cause
Cassidy's
he's a real
vote by
doctor.
promising he wouldn't change that CDC vaccine advisory panel. Obviously, Kennedy broke that promise. He fired everyone on that committee and replaced them. So I'll be watching to see whether Cassidy is going to call Kennedy out for all of the aggressive changes he's been making when it comes to vaccine policy.
What do you expect to hear from Kennedy?
Well, in interviews over the last week, he seemed kind of unbothered by the upheaval at CDC. He wrote an op-ed in the Wall Street Journal over the weekend defending his actions. And in the piece, he places the blame for the high COVID-19 deaths in those early years of the pandemic squarely on CDC, even though I think you could argue that politics and incomplete information about an emerging virus deserve a fair share of the blame. I know what he wants to talk about are his MAHA efforts and what he calls the chronic disease epidemic. So I think he's going to try to keep that the focus as much as possible.
All right, that's NPR's Celia Simmons. Thanks a lot.
Thank you.
Officials in Florida say they plan to be the first state to eliminate all vaccine mandates for children and adults. NPR's Greg Allen reports.
Currently, Florida, like all 50 states, requires children to receive multiple vaccinations before entering school.
Yeah.
In Florida, some, like the vaccine for polio, diphtheria,
You kind of have to, because anybody with a child, which I have a child, knows that they are really great at getting sick and really great at getting other people sick, right? My kid goes to daycare, they pick up a new version of the sniffles, and guess what? The entire household has the sniffles. And sometimes it takes a while for these things, or for these diseases to like build up in your system, right? That you start to actually feel symptoms, but you're contagious the whole time. So it starts as a little, little cough, little sniffle before the full blown illness happens. Maybe we take our kid on a play date with one of their friends, and then now their family is sick too. It's gross. That's why, like, for the public good, vaccine mandates are important, because it's not just your kid that is getting the vaccine and staying healthy and staying safe. It is the community getting the vaccine effectively and staying healthy and staying safe. And it prevents so much just disturbances and problems in everyday life. I said it before, like, getting sick is a burden on people, right? If you get sick, you can't go to work. You might be having to be forced to take paid time off because your job doesn't provide sick days, or you ran out of sick days for whatever other reason, because maybe they don't supply that many in the first place. I think you can only get sick 2 days a year or something. You have to dig into that to pay the bills, or you may not even be able to do that at all. You might be working at a place that doesn't have PTO, that doesn't have sick days that you can call out, and then you're losing income. And then you have to make the decision: do I go to work feeling kind of sick and then get everyone at work sick, and potentially put their own health at risk, or do I stay home and put my own wallet, my own budget, my own rent at risk, my own grocery bill at risk, and then get my entire family sick? And now maybe I'm feeling better, but now my kid can't go to school because they're sick now, right? And they may need to even go to the doctor, go to the hospital. You were able to brush off the sickness, in a couple days, whatever. But they, might be a new disease for them. It's very harsh. Some kids, they react very harshly to disease, especially when they're really young. And boom, now you have an even bigger medical bill, or you're having to take days off because you need to watch your kid because they're not at daycare, they're not at school, right? And then you end up spreading that disease to older folks who have also weaker immune systems, or maybe when your friends, their kids, or their husband or wife is immunocompromised because of an organ transplant or whatever reason, and then they get sick, and then it can be a life-altering event. The only people who really benefit from this elimination of vaccines in our communities and our society is the shill lawyers like RFK Jr., the snake oil salesmen who try and sell like homeopathic remedies or effectively bleach. There's people who do that. They sell dilute CO2, which is like a heavy oxidizer bleaching agent, similar to bleach. And then the only other people who could make money off of it is the people who make tiny baby caskets. So I don't know about you, but I don't want people who make money mass producing tiny baby caskets to have a profitable business. I don't want them having a good quarter, because Ron DeSantis down south of us in Georgia is allowing diseases to come back in full force that have been gone from our communities for decades, right? And don't think it's just going to be Florida. Like, these efforts could easily spread up here to Georgia, north of us in the Carolinas, to the west of us in Alabama, Mississippi. And it doesn't matter if your state is fully vaccinated, right? Because there's a lot of cross-state travel, a lot of families who go and visit each other. You can still get sick, right? Or people who can't get the vaccine because of actual medical reasons, not because they read that the crystals will heal them, and that their kid, being a little socially awkward, was because they got the chickenpox vaccine, or they have a real medical diagnosis caused by genetic factors that we just don't understand yet, or other issues, and they think it's vaccines because they have no scientific literacy. So keep it to that. Hopefully the power of the CDC by the power, or not power, the presence of the CDC in our state here in Georgia, especially up in Atlanta, will be enough to help curb the tide. And hopefully the measles scare that happened earlier this year in Georgia, and we got to watch in Texas where children died, is enough to scare some people. But this anti-intellectualism is terrifying. It's scary. And, I'm fortunate that, my little family here in Southeast Georgia, we've been able to get, all the vaccines. We've been able to get whatever medical recommendations that, licensed professional doctors have given us. We have no medical complications in that respect. But we're lucky in that respect. Not everyone's going to be that. There's going to be people who can't get MMR vaccines. They can't get Tdap vaccines. They can't get the chickenpox vaccine. And their lives are put at risk. When other people who can get it purposely don't because of their own ignorance and their own misbeliefs. But that's what it is. Y'all enjoy this lovely, it is quite lovely on this morning and Thursday here in Southeast Georgia. I think I see like a cloud. So it's going to be a nice, clear, cool day, at least relatively compared to the last 2 months. But it's fall time. It's nice. Y'all have a good one.